I really just wanted to find out a little bit more about, what reproductive psychiatry even is. I mean, I have some ideas. There's a lot of hormones going on, and that's about as far as I get.
And of course, I was thinking it was the preconception portion of the whole process.
Oh, becoming like comfortable with fertility.
And everything. Yeah.
That is part of it.
Okay.
So I get this question all the time. So first of all, just to kind of explain psychiatry and psychology, because I feel like that's also a question that's asked a lot. So psychiatry are physicians who've gone to medical school and then kind of specialize in, psychiatric medicine. And then psychology, they go to graduate school and go on to get either a PhD or a PsyD. So I'm a psychiatrist, so went to medical school and then residency. And then in residency, decided I wanted to do reproductive psychiatry. And essentially what that means is it's treating psychiatric illnesses that have to do with pregnancy, postpartum, menopause, any of those big hormonal shifts that women get to go through.
Fun stuff.
The fun stuff, but also kind of helping men too. So there's a lot of research that partners go through some postpartum depression. I think it's like 10%. So that's also involved in it.
What as you're going through residency, I mean, you're going all the way through pre-med and medical school, and what made you land on psychiatry and then reproductive psychiatry on top of that?
Yeah, so going into medical school, I actually thought I was going to be an OB-GYN. Mm-hmm. I'd worked for an OB-GYN for a year before going to medical school, and I told people, psychiatry would be the last thing I'll do. And I actually put it at the very end of my rotations in med school. And then I got to it and I loved it. And at that point in medical school, a lot of people go through a big period of burnout in medical school, and they've done research on how your empathy drops, and you just kind of lose a sense of yourself in a way. And so I was at that point in my medical school career where I really wanted to focus more on lifestyle and having a life outside of work. And psychiatry was both fascinating to me and could also give me kind of a different life other than just work.
Yeah, you're not rounding at a hospital and different things.
Right.
Well, what's the need for a psychiatrist who specializes so much? I mean, why is somebody who has already gotten their MD in psychiatric care not well suited or not best suited to take care of these kinds of issues?
So I think that's a difficult question, because I think there are some psychiatrists who are very comfortable caring for women during pregnancy and postpartum with breastfeeding. But I think that these women often fall in a gap in that the OB-GYNs aren't necessarily trained on how to manage psychiatric illnesses, and the psychiatrists aren't necessarily trained on how to manage medications during pregnancy. And so they fall into this void where both of their physicians are saying, no, go to the psychiatrist, no, go to your OB-GYN. Mm-hmm. And so it's nice to have somebody who feels comfortable with both aspects. And I think that more and more psychiatry residencies are training people on how to be comfortable with medications in pregnancy. But when I was in training, that wasn't necessarily a common thing, and I think it's just now starting to get more common. But, the OB-GYNs would maybe get an hour lecture their whole residency on mental illness, and the psychiatrists would maybe get, an hour lecture on reproductive mental health. And so, unfortunately, these women kind of fall in a crack where no one wants to treat them.
Yeah.
Or maybe they don't want to so much as they don't feel comfortable.
Right. They don't feel comfortable.
Yeah, I mean, just as a therapist, anytime I hear from a client that they are taking a antidepressant or any other psychiatric type medication that's prescribed by a general practitioner, that's a little bit of a red flag. It's not necessarily a bad idea, but it is concerning because you do want somebody who's got that specialization. And I guess I really value that there is somebody who's covering something that I think has been really overlooked and misread in a lot of ways.
Mm-hmm. Yeah, I think that, having a primary care doctor being able to manage psychiatric medications is great because there are a huge, void of psychiatrists in the United States. But, when you're getting into pregnancy and then you're not only treating the woman, you're treating the baby, and you kind of have a lot of other safety issues that are there. I think it's important to have somebody who can understand all the risks and benefits of using those medications and the effects that it's going to have on the baby.
Yeah. That being the case, do you talk to a lot of people who, maybe their pediatrician or their OB-GYN or some other provider has dramatically misread things or prescribed something that is unsafe or, undertreated or misdiagnosed?
Yes, I've had patients who have come to me who, they were stable on an antidepressant for years. They got pregnant, and then, we've already discussed, hey, this is fine to use in pregnancy. Here are the risks, but, it's better than the risks of not being on the medication.
Sure.
And then they come to me saying, no, my OB-GYN told me it's not safe to take. Mm-hmm. Or I have patients who come in and they've tried probably 10 different antidepressants during the pregnancy, rather than just going to the one that had originally worked because there wasn't research on that. And so, and that's very unsafe too. So there's a lot of things that kind of go on that, aren't necessarily the best practice, and not because they mean anything bad by it, but just because there's kind of, like I said, the education isn't there.
Yeah. How are patients supposed to manage all of these gaps? I mean, if you are going through pregnancy and you're already dealing with the incredible stress and expense that's associated with that and insurance and everything else, and then you're trying to manage all of these different doctors and make sure everybody's on the same page, what can people watching or what can anybody be doing in order to get the right type of care?
That's a great question. There are a lot of organizations out there that can kind of help women get the care that they need, or at least kind of send them in the right direction or provide them with some education. So in Austin, we have a really great organization called the Pregnancy and Postpartum Health Alliance, where anyone can, go on the website or call them, and they have great coordinators who will kind of work with them to figure out, okay, what's the best need for you right now? Do you need someone, to speak with in terms of a therapist? Do you need a doula who kind of specializes in dealing with women with mental health issues? Or do you need a psychiatrist? And they're really great at kind of pointing them in the right direction. There's also an international organization called, oh gosh, now I'm going to forget it. Postpartum Support International.
Okay.
Which is also, good at kind of pointing people in the right direction, giving them a lot of education on what to look out for.
Navigating all of that.
Right. Helping them have the tools to make the right decisions.
Yeah, I know this is naive, but the older I get, the more I realize how ridiculous this model of going to the family doctor for everything is, not just in the sense of one person doing it all, but the idea that you could just go to the health store and get the health that you need, you just go and one-stop shop. Now it feels like people need to have an associate's in healthcare in order to navigate their own treatment.
Unfortunately, I think that's the case for some people. I think for most generally healthy people, having that one person that they can go to for everything is a great model. Mm-hmm. But I think when you are dealing with other comorbidities, other issues, health-wise, one person can't know everything. And so being able to kind of go to different people who have specialties in those areas and
navigate all that.
Right.